When we discuss the issue of gender-based violence, our statistics are such that 1 in 4 girls before the age of 18 would have experienced at least one violent sexual encounter. And over 70% would experience more than one. So when you look at the math, what we see is an average of over 10,000 cases every day in Nigeria where a woman or a young girl is enduring a violent sexual encounter. So many of the young girls and women that we see have been physically attacked. So we're dealing with physical injuries. Then we're dealing with the mental and the emotional injuries that come with these horrific attacks. And then from a medical point of view, you're looking at an increase in the number of cases of possibly HIV or other sexually transmitted diseases because many of these attacks go unprotected when we're dealing with penetrative sexual intercourse. We're also dealing with unwanted pregnancies. And of course, then we're dealing with the long-term medical impact, perhaps, of these attacks that as it affects a woman's fertility. With regards to her family, as we all know, women are typically the glue in their homes. And so an adverse impact on her adversely impacts on the rest of the family.
What are some of the reasons why women will stay in violent relationships?
Well, in this part of the world, in Africa, specifically in Nigeria, the primary reason is the woman's mindset. Women are socialized from a very young age to be subjugated by men. Sadly, young girls see it with regards to their parents and perhaps their mothers, and mothers encourage young girls because it's culturally acceptable to accept their lot in life when they're in families and situations of abuse. And as I mentioned earlier, she doesn't have an enabling community that even empowers her to leave. She doesn't have the resources because unfortunately we are dealing with a low middle income country with a lot of challenges both politically and economically.
So what type of interventions have you implemented that you have found effective?
We work under the health, education, and community service pillars. So with the health, our intervention is providing a sexual assault referral center or rape crisis center in the epicenter of Lagos State, one of the 36 states of Nigeria. And we also provide satellite services in other states. And with this center, we're able to offer free services with the provision of medical and forensic medical examinations. We're able to offer tests such as HIV and pregnancy tests. We're able to give the post-exposure HIV drugs and the morning after pill if we're fortunate enough to see the survivor in a timely fashion. And then we can start our emotional healing with counseling. With our educational pillar, the idea is prevention, going into elementary and tertiary institutions and designing and implementing specific programs to address the needs of the different groups. So with a girl child, for instance, in an elementary school, the focus is on preventing sexual violence, perhaps, and empowering her and giving her the necessary information and knowledge that she needs. With regards to the boy, perhaps it's changing his mindset, because perhaps he already has a mindset of a potential perpetrator because he's socialized in a home of violence where he doesn't know better. And in the tertiary institutions, we're dealing with young adults who now are dealing with the challenges, not just of sexual violence from the home, but also in schools and on campuses. And then finally, the community service was important because many parts of Africa, including Nigeria, is still very much in the rural areas. So we need to take those programs into these rural communities. And there we identify community leaders, we empower them with training, and we then ask them to go back into their communities to raise awareness and assist.
You talked about prevention with the young boy in school, and that's such an important part of the whole idea of preventing gender-based violence. When we prevent it from a younger age, what about the adult men?
Our focus when it comes to men is actually the police force, the law enforcement officers. We have found in Nigeria that a lot of times police officers don't have the necessary sensitivity training or perhaps even the necessary information on referral and protocols in addressing survivors of rape. And so we embarked on a program where we started to go into different police stations to train these police officers, because they are the first point of call when it comes to reporting these cases. I believe violence against women and girls across the world is one of the most pervasive forms of a human rights violation. And like Hillary Clinton said, this is still the unfinished business of the 21st century. And I believe it's time that we finish it.
Thank you so much, Dr. Kemi DaSilva-Ibru, for joining us today.
Thank you very much for having me, Linda.